Hey everyone, are employees coming to you in HR telling you a manager is creating stress or harming their mental well-being? In this episode, I'm going to show you how to investigate these sensitive allegations fairly and effectively, focusing on observable behaviors and patterns, impact, and not medical diagnoses. Tune into this episode to learn some practical steps we can take to protect employees and strengthen workplace culture.
Welcome to the HR Investigations Podcast, exploring the issues, challenges, strategies, and solutions. Sponsored by RPCHR and hosted by Natalie Ivey, an HR consultant, licensed PI, and author of the best-selling book, How to Conduct Internal Investigations, a practical guide for human resource professionals. And now, here's Natalie.
Hey everybody, welcome to the HR Investigations Podcast. I am Natalie Ivey, your host, and I'm so happy to have you with me. Today's episode really comes from all of you, my listeners. Several of you have written to me about a situation that's becoming much more common, employees coming into HR and alleging that their manager is creating mental health issues in the workplace. Now, this is a tricky issue. HR isn't in the business of diagnosing mental health conditions. That's not a good place to be. And I even have a friend who owns an EAP company, and he's always said, his name is Anthony, he said, Natalie, you don't need HR professionals wearing hats of which they're not licensed to wear. All right. Doing that kind of stuff is for the licensed medical professionals. However, when employees say that a manager's behavior is damaging their mental well-being, well, we need to pay attention. So in this episode, I'm going to walk you through how to approach these types of complaints, how to structure an investigation that focuses on workplace conduct, not medical diagnoses, and how to really make fair recommendations that are going to protect both employees and the organization. All right, well, when somebody says, my manager is creating anxiety, or my manager, she's just causing me to just be so depressed. Okay, what they're really sharing with you when they come to HR is the impact actually of that manager's behavior. Look, our job in HR or employee relations, it's not to confirm or deny whether somebody has a mental health condition, but rather to really investigate conduct and whether or not there has been misconduct. And in this example, it's involving a manager. What you have to ask yourself at this juncture is, well, what specific behaviors are being reported? Are there patterns of intimidation, public criticism, unreasonable demands? Has the manager maybe purposefully excluded this complainant from maybe key staff or project meetings? Also, how widespread is this concern? Is this just one employee who is coming to you, or is this something that you are hearing from multiple team members? All right, the idea here is not to kind of step into kind of the psyche of the employee here. What you really have to be doing is continually keeping your investigator hat on and focus on observable behaviors and the specific impact in the workplace. Again, not any kind of medical labels. When an employee really comes in or they reach out to you and you've scheduled a Zoom call with them or whatever your platform is, you're going to really handle the intake conversation, all right? And you're going to want the employee to really share very specific details, right? You need to understand the situations that have arisen here. You need to know the dates. When did they happen? Specific times. You need to know who also on the team, let's say, or other employees that maybe aren't on a team, but have actually observed these situations. Instead of, just getting general statements like, well, he stresses everybody out. You need really something a little bit more substantive than that. Okay. Like on September 10th, during the staff meeting, my manager just shouted at me because I missed a deadline, and he shouted at me in front of the entire team. Now that's a little bit more specific, you see. You also need to really ask yourself, do you have several employees that are coming forward with similar concerns? All right. If several people are independently describing the same behaviors, okay, that's a strong indicator. This is not just an anomaly with your complainant that's sitting in front of you or on the phone with you. This is a strong indicator there's something really systemic that's going on. All right, once you have really had the opportunity to do that, then you really need to move into the analysis of, is this behavior that is in line with our values in our organization? I will tell you the vast majority of people know. When you have someone in leadership that is behaving in this way, right? No. But do keep in mind, it also is a little bit subjective, right? Employees will often embellish a little bit at complaint intake with he shouted at me in the staff meeting or something. Then later, when you really do the investigation, no, you find out that it wasn't shouting at all. What it was is that the employee who was complaining was simply not prepared for the meeting. And the meeting's agenda couldn't even progress because they didn't bring their work that the rest of the team needed. And there was a little bit of them being called out for having dropped the ball. Okay, sometimes people really just don't like being held accountable. All right, so do keep that in mind as well. Sometimes there is a little embellishment. Nevertheless, let's give the complainant the benefit of the doubt here, and let's assume that there's enough substance in the intake that it requires that you do open up an investigation. You then have to figure out, well, who do I need to talk with? Obviously, the complainant, and you're going to document the intake interview. You're going to need to speak with the subject, the person who's accused of wrongdoing. In this example, it's a manager. And then any other witnesses or team members that can provide some of that additional context. And you've got to really look for all available evidence. I mean, what's out there? Are there any emails? Do you have any meeting notes? Do you have any of like the Otter AI, if you will, transcript from Teams meetings or something like that? Turnover data. Are you finding that you've just lost 4 people out of the same department in the last 2 months? Okay, what's going on, right? These are the things that you need to be gathering to help corroborate the patterns of behavior that your complainant has described. When you're also conducting interviews, remember to stay focused on the conduct. Okay, you want to ask questions like, would you please describe for me what the manager said? Tell me specifically. What did the manager do? How often has this happened? Who else observed it? And then, all right, you document that. And then when you interview the subject, of course, you're going to stay neutral. You have to be very careful that you're not going into that meeting already with a little bit of an edge where you're annoyed and you're really feeling like this manager is just picking on their team members. You have to be very careful. People are innocent until proven guilty, if you will, right? And be very careful about your own biases, because this can happen, especially if you have had maybe previous leaders that have kind of been a real tool and you've maybe even moved on from some bad leaders. You have to be very careful that at the complaint intake, you're not already feeling your bias where you're somewhat feeling a little bit of a kindred spirit with the complainant that has shared the allegations. So you have to be very, very mindful of that. All right. What you do have to do is share in enough detail when you're meeting with the subject so that, they can respond. Okay. They may say something like, look, well, I was sitting down with Suzanne and I was coaching performance. I was not yelling. Now that's their perspective, and you have to really, look at both sides without any of that judgment, of course, your bias. All right. Now, once you've accomplished that, you've looked at the data, you've maybe spoken with several other witnesses, you've maybe collected a few emails, or you've looked at transcripts from maybe a few Teams calls, things like that. All right. Look for the patterns of the repeated behavior. Is there any inconsistency in what you learned from witnesses? What's the consistency from one witness to the other, and also the complainant? Okay, what is the consistency maybe from the witnesses and the subject? All right, you may even have a few witnesses who come in and say, well, I know what this is all about. Suzanne really just dropped the ball at our last Teams meeting, and we all were really pretty frustrated because she just didn't come prepared, and now we just missed a project milestone, and this has now caused our project to go into the red. Okay, and the manager is a little annoyed. Okay, so the other team members may very well give you a different perspective sometimes, right? So that's why, again, you have to be very mindful of not going into this being biased. What you're looking at is also the evidence of the impact. How many people have lodged formal complaints? How many people have gone out on, let's say, FMLA for stress-related issues under this particular leader? All right, look at that. All right, and then your findings, when you really are evaluating what you've collected, did the manager's behavior really cross the line into misconduct? In other words, did it violate an organizational policy? All right, even if your employees are describing it as causing mental health issues, okay, your documentation, especially when you write your investigation report, it's really going to be documenting the observable behaviors, okay? In other words, the manager consistently berated employees in team meetings, which multiple witnesses corroborated, something like that, all right? And then when you're really pulling together your findings and then discussing, let's say, with your boss in HR or employee relations, maybe even ethics, and then also maybe a more senior leader who is the one who has to weigh in on disciplinary action. Your recommendations for the subject, if you substantiated it here, may be coaching or training for the manager. You might need to look at a class like respectful workplace, respectful leadership, maybe even managing conflict. I find a lot of times leaders truly struggle with managing conflict. So if maybe they had a differing perspective on the employee's performance and the employee bristled, the manager may not have known how to navigate out of that conflict. So I think that is certainly an area of opportunity for a lot of leaders. Also adjusting maybe the manager's responsibilities if they're really not suitable for people leadership. Look, not everybody is cut out for this leadership thing. I've said that numerous times. A lot of people really want the fancy title. They want the corner office. They want all the perks that come with being a leader. But when it really comes to doing the heavy lifting, if you will, which is managing conflict, sometimes making difficult decisions, sometimes having to deliver unpleasant news to a team member who's not performing, you have some leaders that really, really struggle with that. Maybe they would be better off in an individual contributor role where they don't have direct reports. Okay, but these are really things that an organization has to evaluate. And then, of course, there are going to be those situations where formal corrective action measures are going to be needed, and maybe even terminating someone's employment in very severe cases when you really see that your organization's code of conduct or other policies have been violated. The other thing that's also important, though, is following up with the employees who did raise concerns. In this example, perhaps it's only one complainant, but if you did have a situation where maybe 2-3 employees approached you about it, then yes, you're going to need to go back and let them know, hey, we have taken this seriously, appropriate action is being taken, but you're not going to share the specific steps that you've taken, like corrective action measures with the leader. You want to just give some very, very limited feedback, but just state, the issue has been addressed. And if they say, well, what's going to happen? Look, I am not going to get into discussing that. If you received, let's say, a corrective action, would you want everyone in the department to know that, right? I'm not saying that's what we did here, but what I'm saying is, would you want that to be announced? You see, we are not at liberty to discuss that. We maintain confidentiality around the action steps we take, but what we do want you to understand is that we did listen to your complaint, we did investigate it, and it is being addressed, period, end, right? And sometimes they really do get a little annoyed that they don't know. That happens in any investigation, quite frankly, but that's part of what you have to manage as the investigator. Then finally, I think it's important to just kind of take a step back. If one manager is really accused of creating this kind of toxic environment, is this maybe pointing to some broader cultural issues inside our organization? Do we have other managers who really need leadership development? Have we ever done any leadership development? Some of you might even be kind of rolling your eyes like, wow, Natalie, yeah, it's our organization. We haven't done any training. Okay, well, then it doesn't surprise me that maybe you have leaders that when they get a little bit stressed and when maybe departmental workflow is not necessarily flowing as smoothly as it should be, they may start to exert a little bit of pressure on their employees because they just don't really understand how to problem solve, how to navigate, and how to deal with some of these performance challenges because they haven't really been skilled in performance management. So there's a really big skill gap often that I see. And it's something that I've seen over the years. And, those of you listening to my podcast, I've owned my company 23 years, but I've been around a lot longer in HR and in leadership for a lot of organizations, even before I started my company. And so in my experience, a lot of the issues really are pointing back to those skill gaps. But as I said a little while ago, sometimes you have individuals that really just do not have the right temperament to be in a leadership role. They would be much more inclined in an individual contributor role. They may very well have a high degree of technical capability, but they do not have the right demeanor and capability to navigate conflict and be able to really sometimes deliver messages appropriately. Also, you need to look at policies. Do we have any gaps around maybe respect and workplace behavior? Take a look. How are your policies written? Are they kind of vague? Are they kind of weak? These are things that you really need to kind of do a deeper dive on because investigations, I always say this, they're usually a bit of a magnifying glass. Forgive the pun, because investigators always have a little magnifying glass, but it really does. It puts a magnifying glass on some of the gaps in an organization because investigations are often a reflection of some things that are really not going so well, right? So we have to kind of dig down to the root cause. Is it management behavior? Is it weak policies? Is it that we really have bad management behavior because of lack of training, so on and so forth? Don't just, complete the investigation, move on, and then just keep investigating the same stuff over and over again. That's kind of the definition of insanity, right? We've got to get to the prevention so that we don't keep handling these types of cases. So these situations aren't really just about addressing one bad actor. They're really opportunities to strengthen your entire workplace culture. Investigating allegations around mental health issues, they can be complex, and especially if the allegations are a manager actually doing so. But remember, keep the focus on behaviors, patterns, and impact rather than really medical diagnoses. You're really then going to be able to do a thorough, fair, and then, of course, a defensible investigation. I want to thank you very much for listening to this episode of the HR Investigations Podcast. And if you found today's discussion helpful, make sure you subscribe so you never miss an episode. You can also find more resources in my book, How to Conduct Internal Investigations, and my accompanying supplemental toolkit. And also, if your organization needs some expert guidance, I'd love to connect. You can find me on LinkedIn or in my website at rpchr.com. And by the way, my workshop is coming up, my last one of the year, November 12th and 13th. My workshop is How to Conduct Internal Investigations, a practical workshop for HR professionals. That'll be again November 12th, 13th from 11 to 5 Eastern Time. And in today's show notes, you will find the link to that for you to register and take advantage of the Premier Access discount. That'll save you $100 off registration. And you get to score a copy of my book for free along with registering early. And remember, this is the last one of the year. And I will tell you, seats are limited. All my virtual classes, I limit the seats so that we have the opportunity to really engage as a group. So it's not going to be like this massive webcast with, 1,000 people on it. It's a small, intimate virtual workshop where you really get to roll up your sleeves and interact with other team members. We do virtual breakout sessions, that kind of stuff. So I encourage you, if you are interested in checking something off your professional development action plan for the year, that you go ahead and check it out at rpchr.com/events. All right, gang, until next time. And remember, the best investigation is the one you don't have to do. See ya.
Thanks for joining us today on the HR Investigations Podcast. Be sure to subscribe, like, and share the show with any colleagues who will benefit from our strategies and solutions. For free bonus resources, simply visit hr-investigations.com. And remember, if you'd like some help with improving your investigative skills, or if your organization is in need of an external investigator to help with a case, please get in touch with us. Thanks for listening, and we'll see you in the next episode.